Good afternoon. Before we get started, I want to recognize two special guests who have birthdays today. Mike Nitzel, who is somewhere in the back of the room, and Clif Smart, the president and former president, are having birthdays. So happy birthday to you both, and we will not make you sing, or neither will I. My name is Brian Fogel, and I have the privilege of being both the chair of the Springfield Area Chamber of Commerce this year and also sit on the coordinating board of higher ed. As we all know in this room, a strong, educated workforce is a key ingredient for a healthy economy both in our community and in our state. Employers rely on quality institutions such as Missouri State University and the University of Missouri-Columbia to cultivate a talented workforce who will compete in a global economy. With me today are to tell you more about these two institutions and how they're going to work with our two largest employers, Mercy Hospital Springfield and Cox Health Systems. We have President Clif Smart of Missouri State University and Chancellor Brady Deaton of the University of Missouri and the Honorable Governor J. Nixon. Now in his third year at Missouri State University, I'd like to turn it over to Missouri State President Clif Smart to talk about the exciting changes that will be happening here at Missouri State as a result of this collaboration. Clif.
Thank you, Brian, and folks in the audience, I bet you didn't know one of the requirements to be president of Missouri State University is you had to have been born on September 9th. Given that pool, kind of small, here I am. Let me begin by thanking the Chamber for its support of education. As Brian said, the single best way to advance economic development in our state, bar none, is to have an educated workforce. We are here today to emphasize the importance of health care to the Springfield economy and to discuss how we can all be involved in expanding the opportunities for health care education. There are now some 4,000 students in the College of Health and Human Services at Missouri State University. They are studying everything from nursing, sports medicine, athletic training, in the physician assistant program, physical therapy, kinesiology, public health, communication sciences and disorders, biomedical sciences, audiology, nurse anesthesia, social work, and on and on. That is up almost 1,000 students from just 5 years ago. Why? Because literally 100% of these graduates can be employed in good-paying jobs in Missouri, and because we have a shortage of trained healthcare workers. We are fortunate to have two great partners in Springfield, and I refer to the Springfield Medical Centers, and their CEOs, Rob Steele and Steve Edwards, are both here today, underscoring the importance of this subject, healthcare education. Both of those institutions provide internships and practicum sites for our students. Both are involved in a program with Springfield Public Schools and the Ozarks Technical Community College and Missouri State to allow students who know they want to work in this field to get through school quicker and less expensively. That is a program supported in part by an Innovation Campus grant from the governor's office, and it is working. Both are sending their physician and administrator employees to our university to obtain master's degrees in health administration. We have two cohorts underway now, and I recently had the opportunity to hear Dr. Bharat Shah, a Mercy cohort member student who is also a physician, talk about how important this education was to him, how it was making him a better physician and administrator. And by the way, Dr. Shaw was recently recognized as a 2013 Missourian of the Year. In addition, Mercy is one of our partners at the Jordan Valley Innovation Center, where cutting-edge medical research is happening, and Mercy has supported our sports medicine program and contributes generally to the academic and athletic programs of our university. And so I wanted to thank both hospitals and their leadership for their support to health education at Missouri State. I'd also like to say how much we value our University of Missouri system partners in this field. The MSU UMKC Pharmacy Program begins next fall. Faculty and a director are being hired now. This partnership is a great example of the collaboration between our two university systems, and I want to thank both the governor and our legislators for funding this critical program 2 years ago. We are here today because there are 3 new healthcare programs that need to be funded this year. The expansion of the University of Missouri Medical School, the expansion of various allied health programs at Missouri State West Plains campus, and a new occupational therapy program at Missouri State. Both of these hospitals, our region, and our economy will benefit greatly by the creation of an occupational therapy program and the expansion of the MU Medical School and the allied health programs at West Plains, as there is a great shortage of therapists and physicians and healthcare workers in southern Missouri. I want to thank our area legislators who fought to have these programs included in the budget, and specifically call out Senators Dixon, Parson, and Wasson, as well as State Representative Lincoln Huff. And Governor, thank you. Thank you for your support of secondary and higher education and for fighting to make sure we have a sufficient stream of revenue to fund these new or expanded critical programs this year and in the future. And thank you for being here today.
Thank you, Clif. In addition to Rob and Steve, we have other representatives from both the health systems and from higher ed, and I'd be remiss if I didn't say welcome and thanks for being here today. In addition to the changes at Missouri State, there will be a new name added to the list of colleges and universities that call Springfield home. To talk about that role the University of Missouri will be playing in expanding and improving health care in Southwest Missouri, I'd like to call upon University of Missouri Chancellor Brady Deaton. Chancellor Deaton.
Brian, thank you very much, and it's wonderful to see all of you. It's great to see educational leaders, business leaders, government united in addressing these critical issues that face Missouri, and the healthcare system is certainly one of those areas that really addresses one of the top public policy priorities and real human needs that we face here in the state. And I'm particularly excited to see so much support for MU, Cox Health, and Mercy Health System's plan to expand the medical student class size at MU and create a clinical campus in Springfield. When this plan is fully implemented, this single project will provide more than 300 additional physicians for our state, add more than $390 million annually to Missouri's economy, and create 3,500 new jobs. Those are significant figures. This plan will specifically expand the educational opportunities for students who are preparing to become physicians for the state of Missouri. And our state needs these physicians in major ways. More than 90% of the Missouri counties lack adequate access to health care. We also have a growing elderly population who will require more medical care as they age. And as the #1 provider of physicians and other healthcare professionals for Missouri, MU is well positioned to respond to this challenge. For example, MU, Cox Health, and Mercy Health Systems in Springfield have already spent years working together to train physicians for Missouri through MU Medical School's Rural Track Pipeline program. This program is a perfect example of how MU can enter into the public-private partnership to advance education, to advance health care, and the economy throughout the state. So if you're interested in looking at improvements in the economy and in health care and the quality of life in Missouri, this collaboration of MU, medical care, and the clinical campus in Springfield provides a very high return on investment by any calculation. I want to take this opportunity to especially thank Governor Nixon, to thank our area Chamber of Commerce partners here in Springfield and in Columbia, and our health system partners that I've mentioned before. I also want to thank Senator Kurt Schaefer, Representatives Chris Kelly and Rick Stream, who worked so hard to bring this about, and the Springfield delegation for working with us in a partnership to make this transformational project a reality to the betterment of our state and our communities. Thank you so very much.
Thank you, Brady. These projects would not have been possible without the support of the Missouri General Assembly and Governor Jay Nixon. Together, through supporting these two projects, as well as the 2009 Caring for Missourians initiative, they have made increasing the number of graduates in healthcare professions a priority for our state. The programs you have just heard about are necessary to meet that growing demand for healthcare and should have a tremendous impact on our local economy as well. With that, it's my privilege to introduce Missouri's governor, the Honorable Jay Nixon. Governor Nixon.
Good afternoon. Thank you, Brian, and especially thankful to the rest of the Springfield Chamber for hosting us today and for their strong leadership on behalf of businesses and families in this region. Plus, every time I have a drink here, I realize once again they're the 2012 Chamber of the Year. Something tells me that Mr. Anderson may keep those glasses for a while, but well-deserved honor, my friend, well-deserved honor. I'm certainly pleased to be here with the leaders of two of our state's outstanding universities, President Clif Smart and obviously my good friend Chancellor Brady Deaton of the University of Missouri. And, you know, for those of you who can think back a little bit, I mean, isn't it neat to see the University of Missouri system and Missouri State University signing cooperative agreement here to make this state better? I mean, it's just, just another tangible piece of evidence about how working together can bring a synergistic relationship for a stronger state, stronger regions. You know, those who have careers not only providing healing and care to make our population healthier, but are also a vital part of our well-paid workforce, obviously here at the Chamber. The challenge has been on how to ensure that our colleges and universities have the resources to produce more graduates for these growing fields. 4 years ago, as was mentioned before, we launched Caring for Missourians, a strategic initiative to increase the number of health professionals being educated at Missouri's public colleges and universities, including doctors, nurses, therapists, and many other fields. Our colleges and universities embraced this opportunity wholeheartedly, expanding the number of slots for students to enroll in high-demand training and increasing the number of faculty to teach them. The result have been greater opportunities for students and thousands of new graduated health professionals out in communities providing health care right now. I'm pleased our universities have not only benefited from Caring for Missourians, but have been inspired to move forward in other ways to expand health care training opportunities as the next step. And that's exactly what both Missouri State University and the University of Missouri system are doing, and I want to describe each project very, very briefly. First, I'll talk about the plan by the University of Missouri School of Medicine to increase the size of its medical student class and create a clinical campus here in Springfield through a partnership with Cox Health and Mercy Health Systems. Both of these health systems have excellent clinical training facilities for students, and this would place these students in one of the fastest growing areas of the Show Me State. This initiative is projected to provide more than 300 additional physicians for our state, addressing a critical need for our citizens. The other project involves Missouri State University at both its campus here in Springfield and in West Plains. One portion would begin a new 2-year master's program in occupational therapy on the Springfield campus. Right now, there's only one other public institution in Missouri that offers a graduate level program in occupational therapy. The need is clearly there. The other portion of these projects involving Missouri State University would enhance the nursing and respiratory care programs at the West Plains campus and allow West Plains to begin a new degree program to train more certified nursing assistants. Just like the University of Missouri School of Medicine project, this initiative would help us produce greater numbers of healthcare professionals who will be able to immediately move into high-demand jobs. These projects enjoy the strong support of the area's medical community and other community leaders, including those here at the Springfield Chamber. This year, the budget I signed includes $10 million for the University of Missouri project and slightly more than $1.3 million for the Missouri State projects. These are the types of strategic investments that will help Missouri students step into good-paying careers and will help our citizens be healthier. Unfortunately, there's a little bit of a dark cloud still in this picture, and that dark cloud is House Bill 253. As I've said, as I've crossed the state over the last few months, I vetoed this bill for many reasons. It would raise taxes on prescription drugs and college textbooks, weaken our mental health system, and according to the leading independent rating agencies, jeopardize our state's perfect AAA credit rating. But chief among them was the threat this bill's staggering costs posed to our strong public education system from pre-K to postgraduate. Because of the potential for a $1.2 billion hit to the state budget this year, if House Bill 253 became law, I restricted $400 million in spending in June. That included the funding for the programs we're discussing here today. With the potential for such a significant and immediate reduction in revenue, I simply could not manage the budget responsibly based only on the mere hope that my veto would be sustained. Fortunately, as we have moved closer to the veto session, which is now just 2 days away, an increasing number of legislators on both sides of the aisle have come to understand the harmful impact that House Bill 253 would have on education and other vital services. That's why it's encouraging that as the General Assembly meets this week, the signs are they will heed the call of a growing bipartisan coalition representing educators, business leaders, health providers, faith groups, and others, whose message has been crystal clear: prevent the harmful cuts to vital services by sustaining my veto of House Bill 253. And I'm here today to say that these initiatives by the University of Missouri and Missouri State University are the kind of fiscally responsible, strategic investments that can and will move safely forward if my veto is sustained. That's why I'm proud to witness the signing of this resolution by President Smart and Chancellor Deaton, as these universities pledge to work collaboratively together and with healthcare providers to expand and improve healthcare for the citizens of Southwest Missouri and, quite frankly, the entirety of our Show Me state. So what we'll do now, we'll sit down, we'll sign this agreement, then we'll be glad to take questions from the media. Let's get the agreement signed.